Hi everybody, it's Dr. Dave Woynarowski from drdavesbest.com, and I'm here at the Institute of Human Performance in gorgeous and sunny Boca Raton in South Florida. And I have the distinct and wonderful privilege of being here with a dear friend of mine by the name of Benjamin Velasquez, who is, I'm going to say, the world's top sports rehabilitative therapist. I know that's going to make you uncomfortable, but it doesn't make me uncomfortable saying it. And I think that you folks will see what I mean when we're done here with this initial volume of the Telomere Edge workout series. Now, the purpose of this series is to give you as much information on the proper way to work out. There's a proper way to work out and there's an improper way to work out. 95%, maybe more people, and you see this in your athletes for sure, do not work out properly. They work out improperly, and one of the major reasons they work out improperly is because they don't have the very basic foundations of posture. So the reason we're calling this one Managing Your Center of Gravity is because this is exactly where everybody should start. This is the stuff they should be teaching in schools. This is the stuff that anybody who plays sports or even doesn't, just wants to stay physically fit and move through life with better ease, which is really what longevity is definitely about. Moving through life with ease and health, and of course the actual distance that you stay alive, and the distance that you can cover in the time that you're here. That's very, very important, and we're going to be covering the absolute basics of this. So it may seem very simple to you at home, but what you'll find is that there's no one walking around with perfect posture. There's incredible opportunities for you to improve your posture. And Ben has cooked up just a couple of really simple basic exercises based on a vast amount of experience that you have in dealing with people to help all of us. And folks, I want to tell you, when you do this, it's going to be a little embarrassing to you because you're going to say, gee, I didn't realize how messed up I was. Get used to it. This is something we've all had to deal with. None of us are perfect. But let's talk a little bit, Ben, about the importance of managing your center of gravity and longevity. We're going to bring up some topics about bandwidth in the brain, how much energy expenditure it is, why it's so important in terms of how much energy you have at the end of the day. So explain it the way you explained it to me, how so many people are fighting against themselves, and this is, in my opinion, shortening their lives. And I'll relate it to telomeres in a minute, but you need to hear this. Take it away, Ben.
Well, with relation to posture and I would say longevity, I think in today's society, the biggest issue is that we spend a lot of time seated and we spend a lot of time walking in shoes on hard surfaces. The fact that we're seated compresses our spine, it compresses the muscles in our pelvis, and it causes what's called hypoxia in the muscles of the pelvis, which means a lack of oxygen. So we don't really, we're not built for that. We're built to move, to run, to climb, to squat, basically to move. So the cards are not in our favor with relation to the way society has evolved and managing your center of gravity or executing what we would call good posture. Computers and personal PDAs, everything is internal, everything is here, everything is forward. So everything adds to what we would call a bad management of your center of gravity or a bad management of your posture.
Okay. So essentially what happens is society gets us more or less forward, more or less flexed at most times, and because we spend so much time as part of what we do, whether it's with the PDA, texting, or on a plane, or working on a computer, manual labor is less common as a source of income among more and more of the population. So we are spending much more time sitting in this flexed position. Our brain, our neural patterns are now set up to assume that position much more so than good erect posture. And it affects us in a negative way. Ben talked about hypoxia. I have some injuries in my adductors. Those are the muscles that help stabilize the hip and pull it in and internally rotate the hip. I tore the rectus abdominis, which is one of those muscles of the abdomen. Tore it off the pelvic bone here, tore the pectineus muscle, which is one of those adductors. I tore that off, and I tore it in physical activity. Now, probably I didn't realize I was going to do this because that physical activity was something I had done. It was sprinting, and I've done a lot of sprinting in my time, and this was nothing new. But all the years of sitting, or being a physician is a classic example. Anybody who works at a desk a lot or sits or interviews people a lot, this is a situation where you need to figure out a way to compensate that. So Ben's postural assessment is going to help you look at where you're at. And what did you say? 75% of people have that forward neck, shoulder, and spinal, excess spinal movement forward.
Yes.
And many of us will also externally rotate. You'll see, I think it's pretty rare to see somebody who stands naturally internally rotated in this society, even women who would have a little bit more of an ability biomechanically to do that.
Yeah, posture and center of gravity and center of mass, they've been studied extensively in Europe, not so much here in North America, but and the founder of what we call modern posturology is a Dr. Brico out of France, and his studies show that 74 to 75% of the population in modernized society are exhibiting what they call an anterior scapular plane, or a forward posture. In English, basically what that means is that you're managing your center of gravity forward, so everything has to kind of pull you backwards to keep you from falling over. Your neck is forward, your shoulders are forward, and if you, in the audience, look at 30 people today just in your travels, you'll notice that a greater percentage of them are going to exhibit those same posturological characteristics. What that does to you as just a recreational person or as an athlete is that it's extremely taxing for you to go out throughout the day and manage that center of gravity with that posture. It's not just mechanical, but it's neurological, because your brain adapts to it and your brain starts to recognize that as normal versus what it should be. So it's a very, very taxing way to be able to go through life, and it should be the basis of every program, is to correct that before you move on to an exercise program or a sport or a more rigorous part of your off-season strength and conditioning.
So it actually uses bandwidth up in the brain. In other words, your neurologic energy is being diverted. A lot of you at home, I know from email interactions, complain about fatigue, chronic fatigue, and you're chasing down viral illnesses, and you're chasing down dietary imbalances, and that's all wonderful. But it may be something a lot simpler. It may be something as simple as how you stand. You may be using so much muscular energy, developing areas of acidosis in certain muscles, turning off muscles that should be turned on, and using up a lot of mental energy and bandwidth that you could otherwise free yourself up to do something more complicated, like a sport, or even just whatever your job is. Even if it's a sitting job, if you're fatigued and exhausted, you're not able to compensate. So all the caffeine in the world, all the energy drinks in the world, all of the chasing down the other causes, start with something very, very basic. Take a look at what Ben's going to show you in terms of how to assess your posture, and see if after just a few weeks of practicing what Ben's going to show us today, you don't have a lot more energy at the end of the day, and your movement patterns don't improve. You may even find people say, you look better, or something, you're standing straighter or something. Interesting, some of our folks that have done this have actually seen the world differently. I mean, parts of the way they're standing now, they're not focusing head down and forward. They're actually looking up, and they're seeing a lot more. So it's kind of a magical neurologic experience what happens when you start fixing your posture. But clearly, if you're spending 20-30% of your body's energy neurologically and muscularly just managing that center of gravity, you're functioning at 70% right off the bat. So that's not a good way to age. And if you see, Ben mentioned about the way we sit. So let's just talk briefly about some sources of these kind of neurologic dysfunctions, if you will, in our posture. The first is our own growth patterns. When we start moving at the beginning of our life, we may make adaptations as an infant that no one sees or knows that get us into a movement pattern that is not necessarily the best movement pattern long term. Then there are injuries. Not very few of us have gone through life without some sort of injuries. And those injuries could be muscular, they could be joint, or they could be to the head. The way we understand concussions now is that they can cause a lot more problems than we realize in terms of long-term postural defects and neurologic changes in the way we move. So there's a lot of sources of this stuff, and then just plain old gravity. And as you look at people and they get older, you can see real accentuations of this forward head posture, this rolled shoulder, this anterior pelvic tilt where the lumbar spine is accentuated, and of course the duck-footed walking. You'll see an awful lot of that, and you'll see it especially as we get older. Hence the telomere edge starting at the very, very most basic place, and that is getting your brain and your body to work together, because standing should be more or less effortless, and so should sitting. And most of us, if we're objective about it, we can't stand very long without starting to fidget and move and twist and turn. Same thing with our seated postures. And there's a lot of stuff that we do where we're standing and our glutes, if you feel your butt muscles, they're rock solid. They shouldn't be rock solid. That's primarily a muscle of motion, not a muscle of standing. So when you find your center of gravity, this is going to get a lot easier. If you have a standing job or a sitting job, either way, it's going to improve you. Now, what about longevity and telomeres, okay? So hopefully you understand the importance of what we just said in terms of longevity. Functionally, how you move through the world is the most important thing. If you can't get out of the way of the bus, you're not going to be able to stay alive. If you can't stop yourself from having a major fall, and falls kill directly or indirectly a huge portion of our elderly population. So we want to start working on that as soon as possible so that we don't develop all those things that set us up for a fall. And there's even some studies that suggest because of our postural changes, we don't load the right bones and joints, and we actually have bone reabsorption in places like the hip and spine because we're not loading them properly. We're giving them abnormal load vectors by this standing. And so they compensate this way to more or less grow that way, as my grandfather used to say. So there's a lot of stuff that's going to be coming out of this. Now, does bad posture shorten your telomeres? Truthfully, I don't see how it cannot, but I cannot show you a study that proves that. I'd love to become involved in a study like that, and hopefully we'll get something like that.
Well, I think that it's kind of a cause and effect. In terms of longevity, like you said, longevity, is it longevity for the sake of time or longevity in good health, being able to move and just get around in life? Sure. You know, when you're later in life. There's some studies in Europe again on posture, neurology, and glycogen depletion. For sure, the body that's not managing the center of gravity as it should is going to deplete more glycogen, which is your energy stores. So at the end of a normal day, whether you're a senior or you're a young person just going through your everyday, you're going to deplete more glycogen if you're now managing your center of gravity properly. And in English, basically that means you're going to have less energy to do the things that you want to do. You'll feel tired earlier in the day. There's a direct correlation between managing your center of gravity and being to perform your sport correctly. If your center of gravity is not what it should be, then you're going to cheat the movements in your sport. And it's not if you'll get hurt or if you're compromised, it's when you'll get hurt. Every athlete I test across the board, the ones that don't have injuries are the ones that can manage their center of gravity the best, or they have the best neurological and biomechanical posture to begin with. Sport in itself is not healthy. Sport is competitive. So as a result, most sports will create overuse patterns, so it requires you at some point in the off season to realign yourself, to rebalance your structure, to reestablish a good center of gravity and a good posture,